Does the cesarean section cause infertility? Well, the answer is there is good data now that demonstrates that women that have had cesarean sections actually have decreased fertility. So the question is why? The most likely answer is that the scar in the uterus can sometimes leave a defect. That defect has the worst name ever. It's called an isthmocele, Isthmocele. So essentially it's this little sharp, thin defect where they made the cesarean section cut. And inside that little sharp, thin defect, you collect menstrual blood. That menstrual blood doesn't get a chance to go out because it's kind of trapped there. And as a result, you end up with problems with bacteria, with fluid in the uterus, and several other concerns that can lead to infertility. That's the most likely plausible theory for this. So having simple elective cesarean sections because you're afraid or because you're concerned or worried about your pelvic floor is not necessarily the best path forward. It is something you need to discuss with your doctor if there are reasons to do cesareans and reasons not to, but does it impact your fertility? Yes. Now, I once got asked by a patient if a cesarean section can cause scarring in the uterus, and the answer is the cesarean section in and of itself should not cause scarring in the uterus unless they had to scrape the uterus to get the placenta out, or they didn't do the stitching properly, or they were reaching around and rifling around inside your uterus, at which point, yes, there is a risk of scarring, although that's extremely, extremely rare.